You are now in tune to the most intriguing podcast in the universe. Hosted by the scientist Leon Marshall. Are you ready for Marshall's Melanin Podcast?
Listen, I am fully energized.
Class is in session.
You gonna learn today.
I found it really enlightening, like educational as well. There were a lot of things I didn't know, especially with melanin and like all the benefits of melanin. So I found that very interesting.
I love it. There's so much information, you know, it's entertaining and it's just facts after facts after facts.
This is the podcast where science is made simple and learning is fun. Welcome to Marshall's Melanin Podcast. Now, here's your host, the scientist Leon Marshall.
Yes, large up family. My name is Leon Marshall and you're tuned into Marshall's Melanin Podcast. Large up everyone for tuning in right now. Family, put some ones in the chat. Let me know that you can hear me clearly. Let's check the sounds and let me know where you're tuned in from. Let me know where you're tuned in from. Yeah, large up the family in the building. Large up London, Walthamstow, Hertfordshire in the building, Birmingham. We got Birmingham in the building. Watford. Yeah, large up everyone that's tuned in right now. We're going to be talking about melanin masculinity. The differences between the hormonal balance of black men and other men. Is there a difference? Let's find out. And as usual, at the end, you guys can ask your questions, make your comments, or just tell me what's on your melanin mind. I don't mind what you say. Just be a part of tonight's class. Now I've created this podcast so we can all truly understand melanin once and for all. What it is and how it works. We must change the narrative around melanin if we're ever going to understand it. Changing the narrative means we need to change the language, change the way we talk about and describe melanin scientifically. And that change happens right now. So let's go.
I've been to quite a few and I've heard Leon talk at other events, and as usual you do come away learning something.
Listen, I am fully energized.
That is brilliant. It's just so informative, mind-blowing. It's something that, you know, it's just put me on a journey of knowing thyself. It's just fantastic.
Yes. So large up Tottenham in the building, Oxford. And big up my Birmingham crew. We just came back from Birmingham last week. That's why the podcast wasn't on last week. We was enjoying ourselves in Birmingham. The first Hidden Science Academy physical event of the year. So big up everyone that joined us in Birmingham. I'm going to be talking about that. But tonight we're talking about melanin masculinity. And we're talking about it scientifically.
Sorry, go ahead.
Yeah. So we're going to be talking about the differences in the hormones. Yeah. Obviously, we're going to be talking about testosterone, which is the main hormone. But we're also going to be talking about DHT. Now, for those that don't know what DHT is like a derivative of testosterone. And DHT is actually 10 times, well, I think sometimes they say it's 10% or 10 times stronger or more powerful or more potent than testosterone. Yeah. But DHT is a powerful androgen hormone that's derived from testosterone, and it's actually produced in certain areas of the body. DHT is produced in the skin. DHT is produced in the hair follicles, and DHT is produced in the prostate. Now, you know me, I like to do my research when it comes to science. So I've done some research with regards to testosterone and DHT, and some of the studies that I've found from all over the world have all kind of said the same thing, that black men have an average of, higher testosterone levels than other men. So just look at the graph over on the right there. You can see the source. The source that I got this from was the Journal of Clinical Endocrinology and Metabolism. That was in 2016. They found that black men averaged 23% higher testosterone levels than other men. Yeah. And then DHT, this was a different one from Hormone and Metabolic Research, 2015 or 2016. DHT levels, they found that black men averaged 26% higher DHT levels. Yeah. Now, what effect does this have on our health and on our behavior? Well, higher testosterone and DHT are linked to increased muscle mass, bone density, libido, confidence, competitiveness, and cognitive drive. So there is a difference. Now, when you go online, sometimes they'll say things like there's not a difference, or they'll say there is a difference, but it's not. It's very minimal, so they'll kind of minimize the difference. But there is obviously a difference in the hormone secretion of black men and other men, especially when it comes on to testosterone and DHT. And this is actually what I talked about at the event last week or last weekend. So last weekend we put on a massive event in Birmingham, the hidden sites of black hair. Yeah. Put a 1 in the chat if you came to the event. Over 700 people. So put a 1 in the chat if you was actually at the event. Large up. Miss Angie, Lady Unique. Big up all the family that came and supported us at this event. Absolutely amazing. We had people from all over, obviously people from Birmingham, but we had people drive up and come up on coaches from London. There were people from Manchester. There was people from, big up the people that were representing from Oxford, Bristol, people from all over. Yeah. And as you see the back of the flyer there, we had various expert speakers that were breaking down different aspects of hair. Now, I was one of the speakers and I was talking about male pattern baldness. That's what I was talking about. And I basically said to everyone that if you wanted to understand male pattern baldness in one visual image, this would be it. And I broke down that it was all to do with blood supply. And as you can see from this image, you can see the blood vessels, they're quite thick in the neck. And as they go up into the scalp, they get thinner and thinner. Yeah. So the areas that have the blood supply are the areas where men tend to keep their hair when they're losing it. The areas that they lose their hair are the areas where the blood supply gets, or the blood vessels get thinner and thinner to the point where there's hardly any. So you're not getting that oxygen, you're not getting that blood supply. So obviously anything that happens with regards to the hair follicle, you're more likely to lose your hair. Yeah. So this is a very easy way to understand male pattern baldness. Now the question becomes, okay, so if that's the case, what stops the blood flow, or what constricts, the oxygen from getting to these areas in the scalp? And I mentioned in my talk that if you was to look inside of the body and look at all the blood vessels, the majority of the blood vessels in the body, they're quite thick and large. But as you go up into the head and into the scalp, they get very, very thin. And just that alone means that the blood supply or oxygen supply is going to be a little bit different in the head and in the scalp than in the body. Your heart and certain hormones, they will prioritize organs over other organs. They will prioritize getting oxygenated blood to different parts of the body. And they look at the hair as dead, so they won't prioritize oxygen going to the head. If there's some form of dilemma in the body, they're going to prioritize what needs the oxygen. Yeah. And another thing that can kind of constrict the blood vessels is stress. So I mentioned that your stress hormones like cortisol, even adrenaline, can constrict blood flow. Yeah. And I showed them this, the blood vessel where it's thick and it could get clogged up with what they say is cholesterol or plaque or toxins that could lead to heart disease. But these are the thick blood vessels of the body. Let me show you what the blood vessels of your hair follicles look like. So this is a close-up just of one hair follicle. Yeah. So just think how much this has been blown up, just so you can see. Now just look at the bottom there. Look right down here, just at the bottom of the root of the hair follicle. Look how thin and tiny those blood vessels are. If they constrict for whatever reason, then obviously the oxygen's not going to be able to get to this hair follicle. Yeah. So what causes this constriction? Well, you now know that stress can cause this constriction. Yeah. And obviously stress is going to cause constriction in all of them. So we're not even just talking about oxygenated blood flowing to the scalp. Any part of your body, if you're under stress, is going to be under pressure with regards to your blood vessels constricting. Yeah. But at the event last week, I talked about how stress can have an effect on the hair, and it can literally cause those blood vessels to shut down. Those blood vessels that feed the root of the hair follicle, it can cause them to kind of shrink and kind of get constricted. But there's also a hormone that can do the same thing. A hormone that can do the same thing. It literally constricts the blood vessels that feed the hair follicles. And that hormone is DHT. So I showed this last week as well. I said, is DHT testosterone the problem? And I showed this scientific study this is from 1986. Yeah. And it says serum testosterone levels in healthy young black and white men. And it says blacks in the United States. So this is a scientific study from the United States. Blacks in the United States have the highest prostate cancer rate in the world. Now, notice this. Notice how this is going to connect to prostate cancer. Yeah. So what we're talking about today and what I talked about last week with regards to hair, there's actually a connection here. And it's this DHT testosterone. So it says blacks in the United States have the highest prostate cancer rate in the world and nearly twice that of whites in the United States. 2-to-1 ratio. Yeah. 2-to-1 black to white ratio in prostate cancer rates is already apparent at age 45. They go on to say that this finding suggests that the factor responsible for the difference in rates first occurs early in life. And then they say testosterone has been hypothesized to play a role in the etiology of prostate cancer. Did we know this? Now, why is testosterone hypothesized as playing a role in prostate cancer? Because DHT can increase the size of the prostate. Yeah. DHT increases the size of the prostate because that's kind of like one of its roles is kind of whilst you're going through puberty and all that sort of stuff, it increases stuff. But yeah, if DHT is out of control, it can increase the size of the prostate. And it says here, this report gives the results of the essays of circulating steroid hormone levels in white and black college students. It says mean testosterone levels in blacks were 19% higher than whites and free testosterone levels were 21% higher. Yeah. And then it says both these differences were statistically significant. So, and then at the end there, it says a 15% difference in circulating testosterone levels could readily explain a twofold difference in prostate cancer risk. So according to this study and some studies after it, they're saying that there's a link between DHT and prostate cancer because DHT has somewhat of a proliferating effect on cells, tissues, and organs. It can increase the size of things. Not only can it increase the size of your prostate, it can increase the size of tumors. So if there is something going on in your prostate, whether it's a tiny cancer cell or a tiny tumor, it will increase the size of that as well. Interesting. Yeah. Interesting. And when I started to learn about this, I always look for solutions. Now, if you ask the experts, what are the solutions when it comes on to DHT? Because if DHT is getting out of control, and we're going to discuss why it could get out of control and become imbalanced. But if DHT has become imbalanced and all of a sudden DHT is causing hair loss because it's constricting those blood vessels, what's the solution? Well, if you go with the quote unquote experts, their solution is to block it. So they will give you DHT blockers, medication. Yeah. They promote these all of the time. This one's called Alpha Block. They're literally telling you what they're blocking. Yeah. They're blocking testosterone. Now, me using just common sense and logic, if there's something in your body, something that the body is producing, it's doing a job, it's doing a role. If you block it, there's going to be a knock-on effect. You can't just block it and everything's fine in your body. If you block it, there's going to be a knock-on effect. And let me just show you what the knock-on effect is. It actually starts with cholesterol. Another thing that they like to block, by the way, using drugs. So that a lot of us, when we go to the doctors, they'll say, oh yeah, black people, you got high cholesterol or high blood pressure. They put you on statin drugs or they put you on a drug to block cholesterol. Many of us don't know that cholesterol is the precursor to our very, very powerful hormones. This is men and women, yeah? Cholesterol is the precursor to pregnenolone. Pregnenolone is the precursor to progesterone. And progesterone is the precursor to the steroid hormones that our bodies produce, whether it's estrogen, adrenaline, cortisol, stress hormones, and testosterone. So if you block DHT, family, you don't even need to be a scientist. This is not rocket science. You put in the chat, if you block DHT, what could potentially happen? Put it in the chat just by using common sense. DHT, remember, DHT is a derivative of testosterone. So as a man, if you block testosterone, what's going to happen? Imbalance, yep, there's obviously going to be a hormonal imbalance. But in particular, let's just put two and two together. If you block testosterone, what's going to happen to you as a man? Or what could happen, let's say? More estrogen, yep, estrogen's going to go up. Big up Miss Oswald, she said turn to a woman. Yeah, maybe. Affect fertility, yes. Estrogen development, yes. Sterile, yeah. Feminize you, yeah. Reduce maleness, there you go, yeah. And when we say maleness, what are we talking about? Well, it could reduce your libido. You could start to suffer from erectile dysfunction. Yeah. Your masculinity, your maleness, yeah? All right, so we're getting this. Okay, now I'm going to show you a clip from this podcast. This is a podcast where two doctors are talking about the effects of low testosterone on men's health. This is from, for those of you who may want to watch the whole thing, it's BioBalance Healthcast. That's what they call it, BioBalance Healthcast. And these are two doctors talking about the effects of testosterone. Listen very carefully to what they say.
Today we want to aim our conversation particularly towards men to make men aware that there are physiological signs that are visible of the deterioration of their testosterone limit as they age. And we want to remind them that testosterone is the first step in the aging cascade. And so
testosterone loss.
Testosterone loss, yes, thank you. As you begin to lose this testosterone, the guardians of your health in your body, the hormone system, begin to weaken, decline, and break. And there are things that can be done to prevent that so that you stay healthier longer and have a better quality of life as you age.
All right. So according to these doctors, for men's health is your health is kind of reliant on that very powerful hormone called testosterone. So when you start to lose that, your health will start to rapidly decline. Yeah. And then he says he's going to go into ways in which you can kind of prevent that. And I'm going to go into ways in which you guys can increase your testosterone naturally. I'll go into that a little bit later. But before I do, the lady, the female doctor, she's going to go on to talk about signs of low testosterone. Yeah. And remember, these are doctors, so they studied this thing. Listen to what she says when she talks about signs of low testosterone.
So one of the things that testosterone does that helps me, like, walk around in crowds and know what man needs testosterone. What it does is it stimulates another hormone called melanin. Melanin gives us our skin color, like tan, whatever skin color you were, meaning easily tanned, not easily tanned, but maintaining that skin color that you're born with. So melanin is the hormone, but stimulated by testosterone to give you your skin color.
Testosterone is the gas that goes in the tank, and then the tank produces the melanin.
Right. That's right.
But without the testosterone, the tank's empty, and
the melanin is produced at a very low level. Right. So when I'm looking at a patient, or when I can't help the looking at everyone, I first see on a male whether they look pale, like pasty pale,
white
pale,
heart attack.
And I'm not saying that that's the only reason you can be pale.
Okay.
But it is one of the signs
that needs to be checked.
That if you have that and you look in the mirror and you never tan anymore, or your tan doesn't happen anymore, and you're a guy, you go out in the sun.
Is it a waxy kind of?
No, it's not waxy. It's not really a texture. It's a lack of color.
Okay.
Lack of color. Lack of color. To all these people, I don't see color. In science, you have to see color. That's how important color is. Yeah. Doctors all the time, even when we were younger, when you go to see the doctor, one of the first things they're going to check on you is your face and the color of your face. Yeah. A lack of color. Yeah. So that's her way of testing whether someone's got low testosterone levels. Are they pale? This is from this doctor, This is from this doctor, yeah? And then, you should never just go by what people say. I never just go by what people say, even if they are quote unquote experts. So I just typed into Google male hormones and melanin. And you guys can do this as an experiment yourselves. Type in male hormones and melanin. Then Google's AI takes over, and Google's AI said, male hormones, primarily testosterone, play a role in regulating skin pigmentation by stimulating melanocytes, the cells that produce melanin. Increased testosterone generally correlates with higher melanin content and darker skin tone, while deficiency can lead to paler skin. Boom. Yeah? So according to the experts, this is not even Lil Marshall now, according to the experts, darker skin is actually one of the things that they look for when it comes on to high testosterone levels. Yeah, because that's the melanin. Yeah. So darker skin. Now, this is the reason why I feel like we need to learn our health from a Black perspective. Because remember, they always tell us that, the reason why we have melanin is to protect us from the sun. That's the reason why you have dark skin. That's the reason why you have melanin, is to protect you from the harmful UV rays of the sun. Well, if that's the case, if that was true, then that would mean that the darkest areas of our body should be the areas that are exposed to the sun. Yeah? Now, just using common sense, again, this is not rocket science. You don't have to be a scientist to understand this. Family, what are the parts of your body that are most or mainly exposed to the sun? Put it in the chat. What parts of your body, whether it's a hot day or a warm day, what parts of your body are the main parts that are usually exposed to the sun? Thank you. So your face, your hands, yeah? Your face and your hands, and yeah, if you're wearing a t-shirt, your limbs, your arms and that sort of stuff. Now, question just for the Black men, or anyone who wants to answer, but Black men, generally speaking, point to the darkest part of your body. Is the darkest part of your body your face? No. Generally speaking, Black men, the darkest part of your body is not your face. It's not your it's not your hands, and it's not your arms. It is, like everyone is putting in the chat, it is down there. It is the elephant in the room. It is the elephant in the room. Yeah? So when we're talking about testosterone, family, this is the reason why down there is so dark. That is due to testosterone, which represents virility, which represents strength, vitality, and vigor. Again, this is the elephant in the room. This is what they don't want us to understand. That is the reason why down there is so dark. It has nothing, and I repeat, nothing to do with protecting us from the sun, because down there doesn't even get exposed to the sun. So why would it be darker down there? This is what you need when you guys are speaking to experts. This is what you need to ask them. If the reason why we have melanin is to protect us from the sun, why is the darkest area of my body down there and it's not even exposed to the sun? And just listen to them tap dance. Yeah. So now, and again, I'm not even dropping science. This is just common sense. This is just using logic. Yeah. Now, because we're talking about black men and black men's health, let's go on to this. In the UK, this is a big issue. Prostate cancer and black men. Now, prostate cancer is to do with hormonal imbalance, for those who didn't know. So again, we're talking about testosterone, DHT, all of this sort of stuff. And I'm sure a lot of you are aware, in the UK, 1 in 4 black men, according to the NHS, will get prostate cancer. Will get prostate cancer. How do they know that we will? According to them, they know 1 in 4 black men will get prostate cancer. Yeah. And if you've been following me, you know how I talk about this is a narrative. I call it the more likely to narrative. And the way they push the more likely to narrative is they get black people to push it to black people. Yeah. So they'll either pay or not pay. I don't know. You have to ask the people who push it, but they'll get prominent figures to push this more likely to narrative. For those of you who are new to the podcast, the more likely to narrative is black people are more likely to die from, and then insert whatever disease they say. So during COVID, it was black people were more likely to die from COVID. Then nowadays they're talking about black women are more likely to die from childbirth. Now they're talking about black men are more likely to die from prostate cancer. It's the more likely to narrative, and they get us to push it to us. So the last year, I'm sure some of you saw this. One of the most prominent DJs on the social media circuit is this DJ called DJ AG Online. And he came out last year urging black men to go get tested. Listen to this.
This is not a video I thought I'd ever make, let alone post, but here we go. I've been suffering with testicular pain for the last 2 to 3 months. Managed to get an appointment, it took a while. I missed the appointment due to fatigue. Rebooked the appointment, so I went this morning, 8:45. Went to the doctors, I explained my symptoms, and I thought, oh yeah, it's gonna get a blood test and then they'll come back with I'm good, or like there's further investigation required. So it's like, give me the symptoms, give me a bit more information. So I explained that sort of, my concern was cancer runs in my family. Some of my friends have ignored the symptoms. So I think I just want to get checked out. So he's like, all right, cool, fine. Didn't take no blood this time. He's like, let's get onto the bed and I'm going to examine you.
Uh-oh.
So he examined my belly, had to lay on my back first of all. And then he was like, okay, I want you to turn to the side now. I'm going to examine you.
What?
So I have to put my finger in your behind, yeah?
Uh-oh.
I was like, I was not expecting this. So turn to your side. You go into like a fetal position where your knees are up towards your stomach. Put some gel on his finger. I've never experienced that in my, the discomfort. I get why people don't do it. And your prostate is so far up, wow. However, it's important. It's important that we get checked, especially to preserve life. It's important. So if you've got symptoms, please get checked out. I salute all the women, getting your smear tests. That must be really uncomfortable. Also, for the guys, man, I know, even culturally, yeah, that's a bit mad, isn't it? But
it is.
We have to do it, and it's important that we all get checked. And just
we have to do it. We all have to get bent over by doctors? No, we don't all have to do that, bro.
For the guys, man, like, I know, even like culturally, yeah, that's a bit mad, isn't it? But we have to do it, and it's important that we all get checked. And just for that 2 to 3 minutes of discomfort, like, the peace of mind, like, and preserving life is important. I want to fulfill, you know, what I believe my destiny is. I want to be here for my family. So I'm willing to just do what I need to do in terms of getting checked. Next steps, get MRI, do my bloods, and then we go from there. But yeah, please, everyone, like, if you feel any symptoms, like, please get checked out, man. It's important.
All right, so that's DJ AG online, one of the most popular DJs online right now, saying to black men, go get tested, go get tested. Now, I want you to notice what he said. He went to go get tested for testicular pain, and they bent him over and started testing for his prostate. Okay, now, and then he says it's very important for black men to get tested. Here's my thing when it comes on to getting tested, yeah? I think it's important as well. However, what DJ AG was not aware of is that they don't have to do that test on you. They don't have to stick their fingers up your bum to test you, yeah? All they need to do is just a simple prick of your finger and test your blood. And I found this out by this guy. This guy, he's from Prostate Cancer UK, or he's just the advocate for Prostate Cancer UK. Some of you may have seen him on TV before, but he's always, you know, championing Prostate Cancer UK and black men go get tested and blah, blah, blah. Again, because DJ AG is so popular online and on social media, Cancer Research UK reached out to him and asked him if they could do a PSA on his set. So for those of you that don't know, he does these sets that are outside in London, and he gets a lot of people, a big crowd, and he's just playing music. Cancer Research UK on one of his sets brought this guy down to do a PSA. Now listen to what the guy says in the PSA.
Forget this nonsense about finger up the bum madness, right?
Okay.
It's none of that.
Well, you know why I'm here?
Yeah, man, I know.
Prostate Cancer UK, yeah? So this is something that affects so many men here in the UK. 1 in 8 men are affected. For black men, it's 1 in 4. I've got some people that are very special to me who have been affected by this. It affects so many people because I'm not just here as a broadcaster. I'm here as a son, as a brother, as a friend, to speak to the community. Because you, right now, you are the community guy.
Listen, proud of this man because he's gone public on this conversation, right? This is a big issue that affects us, and I'm proud and honoured to be an ambassador for prostate cancer.
And by the way, he said he's proud of DJ AG because he went public. I would second that. I'd say that black men need to speak up more about their health. So yeah, we give him props for kind of speaking up about his health and that sort of thing. I'm always skeptical about black men telling other black men to go get tested when you weren't doing that before. So, because I feel like they pay you to say that. However, you just talking about your health, yeah, you should be commended for just talking about your health.
Right, this is a big issue that affects us, and I'm proud and honoured to be an ambassador for Prostate Cancer UK. Right, guys, this is an important message. Right, go and tell your brothers, your fathers, your uncles, every man that you see, right, and you talk to, tell them about the prostate cancer risk checker, right? Go on the Prostate Cancer UK website, right? Pick up the details for the prostate cancer risk checker. It's so important. I had this illness, right? It's left me with incontinence and erectile dysfunction, but you know what? I'm alive.
Yes!
I'm alive. Forget this nonsense about finger up the bum madness, right?
Okay.
It's none of that rubbish, right? It's a simple pinprick blood test.
What? It's a simple pinprick blood test. If that's the case, why did they bend over DJ AG? If that is the case, because by the way, for those that don't know, that used to be the case. That used to be the only way they used to do a prostate exam, yeah? They used to get men and bend them over, put a glove on, put some lube on the glove, and then put fingers up their bum. They don't have to do that now. It's just a simple pinprick test, yeah? They don't have to do that. So why were they bending over DJ AG? What, those doctors didn't get the memo that you don't have to do that test no more? Why were they doing that? Yeah. And what's crazy is I don't know if DJ AG knew that they didn't have to do that again. It's like this was news to him. Because I don't know if you guys noticed, don't know if you guys noticed DJ AG's face when the brother says none of this finger up the bum nonsense. I'm gonna play it again, and I just want you to watch DJ AG's face when he realizes he didn't have to get bent over. Watch his face, yeah? It's the funniest thing. I've only just noticed this, yeah? But just, I'm gonna look, zoom in so you can watch. Just watch DJ AG's face when the brother says, forget this finger up the bum nonsense, yeah? Watch his face.
Forget this nonsense about finger up the bum madness, right?
Okay.
It's none of that rubbish, right? It's a simple pinprick blood test.
Did you guys see his face? He was like, wait a minute. He started blinking fast. You know when people blink here? That's them trying to process information. He was like, wait, hold on a second. They bent me over. What are you trying to say? That they didn't need to bend me over. Watch it again. When I first realized this, I was busting up, right? This is when he actually realizes they didn't have to do that to me. Watch his face.
Forget this nonsense about finger up the bum madness, right?
Okay.
It's none of that rubbish, right? It's a simple pinprick blood test.
Oh my gosh, when he realizes, hold on a second.
Forget this nonsense about finger up the bum madness, right?
Okay.
It's none of that rubbish, right? It's a simple pinprick blood test.
He was like, okay, what? Well, that's what they did to me. Like, you get me? They bent me over. So I don't know. Like, and this is the thing. Again, like I say, this used to be the only way they used to test for prostate. Yeah, by bending men over and doing this type of foolishness. Now, you know, no disrespect, but white men, they're used to doing this type of stuff. They're used to debauchery and sodomizing and, you know what I mean, bestiality and all that sort of stuff. They're used to that. So there's no wonder why this was the test for a prostate exam back in the day. But they're doing this to black men all the time now. And again, they don't have to. If you're going to go get tested, just get the simple pinprick blood test. You shouldn't be getting bent over for all the men now who are being told, go get tested, go get tested. No doctor should be putting on a glove and putting lube on the glove, fam. Just so you know, no doctor should be doing that to you. Don't make no doctor bend you over. You understand? Because that's a way of demasculinizing us. And I break this all down in my book, by the way. For those that don't know, I'm the author of The Hidden Science of Melanin. I break this down. We need to start understanding our health from a black perspective so we don't fall for these little tricks that they do. These little embarrassing rituals that they do, yeah? Like someone in the chat said, it's like a humiliation ritual doing that foolishness. So we've got to be careful with the experts because the experts don't want to tell us about melanin, yeah? And that's my thing. If you're an expert, tell me about melanin. Tell me about the differences. Tell me about DHT and testosterone and how, you know, my DHT and testosterone is a little bit higher than other men. Tell me that, yeah? And speaking of experts, when it comes onto prostate cancer, especially here in the UK, this is an expert called Mr. Jonathan Noel, yeah? And a couple years ago, I was on a prostate cancer forum with him. And he was breaking down what he does with regards to treatment. And let me just show you some of the machines that he uses, because he was quite frank and quite honest on the prostate cancer forum. And he was telling everyone on the forum what he uses with regards to prostate cancer treatment. Just check this out. This is one of the machines that he uses as a surgeon. Check this out.
I'm going to just speak about treatment in the form of radical surgery. You know, in the UK, 90%, if not more, of removing the prostate gland is done with this nifty little bit of kit, which just allows us to do the surgery and you to go home the next day. And your risk of needing a blood transfusion is essentially less than 0.5% for the most part. And you get back to work, get back to home to your loved ones, and recover quickly.
Well, there you go. So he's saying you can use this. And look at this. It's like Robocop. This is the machine that they use to, you know, cut out black men's prostate and do all types of treatment with it.
I'm going to just speak about.
Okay. He says recover quickly. So he says that when you use this, you don't have to stay in the hospital. You can recover quickly and come out quite quickly. Interesting. All right. Now watch what he says here. Still talking about these machines. Listen carefully.
This is a colleague, Ben Chalacombe, on the right. That's me using a new robot that we just launched. And I think we are allowed to do the surgery now with new robotic technology that is affordable in an NHS situation. And I think that is something that I am excited to explore because it would be a real passion of mine to introduce it to a Caribbean setting.
Wait, what? Did you guys hear that? He said he is passionate about these new robots because he wants to start using it on what community? I don't know if you guys caught this. When the experts talking, though, you got to listen, yeah? Listen to what he said.
This is a colleague, Ben Chalacombe, on the right. That's me using a new robot that we just launched. And I think we are allowed to do the surgery now with new robotic technology that is affordable in an NHS situation. And I think that is something that I am excited to explore.
Excited!
It would be a real passion of mine to introduce it to a Caribbean setting.
Okay, so why us? Why would you want to do it on us? And I'll tell you why, by the way, because when they talk about black people are more likely to this and black people are more likely to die from that, when you go into the black categories, because they like to categorize blackness. It's not just black people. You'll go into the category, it'll be black African or black mixed or black Caribbean. Notice, I don't know if anyone's noticed, but I do because I follow their research and all that. Anytime they talk about black people are more likely to die, when you start going into that black category, it's always black Caribbean people that are more likely to die. Yeah? Black Caribbean women are more likely to die. Black Caribbean men are more likely to die from prostate cancer. Why is that? Well, according to this expert, he don't know, but oh my gosh, I'll be so excited to treat you guys with these new robots, with this new technology. I'd love to just treat you guys.
Newer robot systems coming on the market.
Now, let me show you this. This is a treatment summary. Again, this is him showing what he actually does. 3 different types of treatments you can see: radical surgery, radical radiotherapy, and local therapy. Oh, no, focal therapy. Listen.
I can't speak on treatment for the present without addressing or speaking to focal therapy, which some of you may no doubt have heard. This is a slide taken from Imperial College, which is the biggest user of focal therapy. This compares radical removal of the surgery of the prostate with robot on the left. This compares the radiotherapy, which is a big square with the radiation dose. And the focal therapy just targets the area on that MRI scan with either a very cold therapy, cryotherapy they call it, or for ultrasound waves, focused ultrasound waves. And they're seeing that patients get to preserve a lot of their continence, their erections, their ejaculations, because with radiation treatment and radical surgery, most of these things are impacted.
Oh, so he says most of these things are impacted. Look at this. Incontinence. Now, again, this is a little scientific jargon, so let me see if I can break it down simply. Incontinence, yeah? So if you do radical surgery, there's a 25% chance you will suffer from incontinence, yeah? If you do radical radiotherapy, that 25% goes down to 5%. However, your impotence could be up to 60%. So you might as well say, if you have radical radiotherapy, there's a more than likely chance, 1 in 2 chance, you're bound to be impotent after this surgery. This is what this is saying, yeah? And then if you go for focal therapy, your impotence goes down to 15%. Woohoo, 15%. You're more likely to become impotent, but ejaculation goes up to 60%. What does that mean? Does that mean you can't ejaculate? What? Listen. So I get, for the people who don't want to learn about themselves from a black perspective and listen to these experts, this is their solution for you. Yeah. So they're telling you when you go for surgery, you're going to have urinary issues, incontinence, and impotence, and ejaculation issues. Just so you know, I'm not telling you to not go and get treated. By all means, do whatever you feel is right in your heart. But this is what's going to happen. It's not might, 60%, fam. I mean, come on. All right. Now, is there anything else that could happen from treatment? Let's say, for example, a biopsy. What could happen if you go and get a biopsy, which they push on black men all the time?
The other thing to say is in the past, well, actually in the present, in some parts of the world, transrectal biopsy is still performed. Probe in the rectum and the needle traverses the rectum to biopsy the prostate, to get tissue, to find out what's going on, to see if you have cancer. It's a test that most urologists are familiar with, but it's a test that had risk factors of infection, hospitalization, and very rarely, but very significantly, infection that could make men succumb to their infection by death.
Oh, what? You kind of he kind of started by the end, but let's just hear what he says right at the end.
Infection by death.
Infection by what?
It could make men succumb to their infection by death.
Death. Okay, so all right. So again, I'm not telling black men what to do with their health, but if you do go get treatment, know that it's going to cause impotence, incontinence, urinary issues, ejaculation issues, and let's not forget that DHT is actually produced in the prostate. So if you remove your prostate, you're going to suffer from low testosterone, family. You're going to suffer from, there's no doubt about it, because DHT is actually produced in the prostate. So if you remove the prostate or do some type of surgery on the prostate, it's going to affect your testosterone levels. And the last thing, which you can't even call a side effect, but he kind of ums and ahs and kind of stutters, but he says, and you could die from it. And you could die from the treatment. So all of these black people are more likely to die from prostate cancer. Black men, you're more likely to die from prostate cancer. Maybe they left out a word. Maybe black men are more likely to die from prostate cancer treatment. Have you ever thought about that? So when they say we're more likely to die from something, add treatment on the end of that, yeah? All right. Now let's go back to the BioBalance Health Cast. These two doctors talking about low testosterone. And let's go back to this woman doctor who says she looks for things when it comes on to low testosterone. What else does she look for with regards to low testosterone? Listen.
I also look for the development of the man boobs.
Uh-oh.
You know, which you can't always see through clothes, but if somebody sits down, you might be able to see them because they kind of sit on top of here. And that's an estrogen problem and a low testosterone problem. And then I look for hips. Sometimes guys who are getting older develop fat around their hips, which they usually don't have when they're young. So it's more of a female prototype.
Yeah.
Because the estrogen's there and it's getting higher all the time, and the testosterone's
So as men lose
decreased.
testosterone, they become more androgynous?
Yeah, we all become more androgynous as we age without hormone replacement.
Okay.
You've seen older people
I have, yeah.
who are very old in their 90s who look like the opposite sex. It's hard to tell.
Yeah.
What? I don't see that. Not in my community. No, I don't see. Listen, when I look at elders, the men look like men, the women look like women. So I don't know what she's talking about. Maybe that's her community. Yeah. Do you get what I'm saying? As we get older, yeah, you're going to lose your testosterone and estrogen, but you shouldn't lose so much testosterone that you start looking like a woman. That's not normal. Do you get what I'm saying? But anyway, yeah, that can happen. Sometimes women start to grow hair on their face, beards and that sort of stuff. Yeah. All right. But let's go into solutions now. So we've gone into the problem, talking about black men's health, masculinity, and the fact that certain things can attribute to men having low testosterone, including, you know what I mean, doing their surgery. Doing any type of surgery can lead to low testosterone. So what sort of things can black men do naturally to increase their testosterone? What sort of things could black men do naturally to increase their testosterone? So let's go through a couple things. Hopefully this should help the family. I'm sure every single one of you has someone in your family who this information could help. Number one, let's start with strength training. Yeah. lifting weights can actually increase testosterone. Yeah. Focusing on compound movements though. So even though, working on your biceps is kind of like it's what we call a mirror muscle. It's kind of like lifting your ego. You want to focus on compound movements like squats, deadlifts, bench press, that sort of thing. Yeah. Lifting heavy weights can actually increase your testosterone naturally. Training regularly throughout the week, 3, maybe 5 times a week, short, intense sessions, those sort of things boost testosterone levels. Yeah. Resistance training. You'll see that the people who kind of do work out on a regular basis and do it regularly all throughout their life, even into their 60s, 70s, and 80s, they tend to look better. They tend to look healthier. Yeah. So that's one thing. Strength training. Yeah. Number two, sleep. Yeah. Prioritizing high quality sleep. Now, check this out, family. I know this is hard for a lot of us, but you should be getting 6 to 8 hours per night. 6 to 8 hours per night. Now, put a one in the chat if you get at least 6 hours per night. Put a one in the chat if you get at least 6 hours of high quality sleep. All right, quite a few. All right, now I just want you to be honest because we're a family. We're here to help each other. Put a one in the chat if you don't get at least 6 hours of quality sleep per night. There you go. So yeah, it's not everyone. Like we sometimes we don't realize how important sleep is with regards to balancing our hormones and kind of resetting the body and that sort of stuff. But testosterone is largely produced at night when we're sleeping. So if we're not getting sleep, black men, even black women, but black men, if you're not getting sleep, your testosterone levels are going to be whacked. Absolutely whacked. All right, so that's number two. Let's go on to number three. Eating a balanced diet. I don't need to tell people what to eat. Like, you know what's kind of good for you and you know what's not. If you want to know what's specifically good for you or melanin, then get my book because I've actually got a chapter in there that's called Foods for Melanin. But yeah, a lot of us, we know when we're eating the wrong types of foods. And it shows. Look at this guy. You're starting to see the man boobs. Look at the man boobs. That's estrogen. That's a lack of testosterone when your chest starts to do this. Yeah? The man boobs, the big stomach, the big belly. That is a lack of testosterone. Yeah? So get out there. And speaking of getting out there, exercise outside because a lot of us, again, don't understand the importance of sunlight when it comes onto our melanin and vitamin D. Yeah? We need to be getting enough vitamin D because low vitamin D is strongly linked to low testosterone. So we need to be getting out there. And no, we shouldn't be taking vitamin D supplements. Those same people that are pushing for us to take vitamin D supplements are the same people that push for us to take the vaccine. Why would you listen to these people? These people are like, oh, you guys are low on vitamin D. Take this supplement. No, they should be saying, you guys are low on vitamin D. Go on holiday. Get out there in the sun. You don't have to be in Jamaica to get sun. Go, I don't know, Turkey or somewhere or Portugal. And Portugal's only 2 hours away. But get out there in the sun because that is medicine. Sunlight is medicine. Everyone's saying, oh, what about vitamin D supplement? From who? From who? Who? The same people that are pushing vaccines on us. No, fam. No. All right. Also, alcohol. Heavy alcohol consumption lowers testosterone. Alcohol and drugs. Yeah. Alcohol and drugs. Alcohol lowers testosterone. Obviously, I'm not the pleasure police. Some of us like a little poison, a little, you know what I mean, a little alcohol here and there, celebrating whatever. But excessive, heavy alcohol consumption can lower testosterone. So if you're someone who wants to increase your testosterone levels, you got to cut down, limit your alcohol and avoid drugs. And when I say drugs, I want us to drop the euphemisms. When we think of drugs, they make us think of these hard drugs that there are laws behind it. No, if you're on medication, you are a drug taker. Not to be so blunt or rude, but I want everyone to understand. You get me? Drop the euphemisms. Drop the nice words. Medication. What's medication? That's drugs, fam. So if you're on drugs, you are a drug taker. I just want everyone to understand that. And I'm not saying it's a bad thing or a good thing. I just want you to understand if you are on any type of medication, you are a drug taker. You take drugs. Yeah. And what else can I put under that drug category? Vaccines. Yeah. So if you've taken any type of vaccine, and again, I'm not finger wagging, I'm not saying you shouldn't have or whatever. I'm just saying a vaccine is a drug. Yeah? A vaccine is a drug. A flu shot is a drug. So if you've taken a vaccine, if you've taken a flu shot, you are a drug taker. You take drugs, and drugs will affect your hormones, especially testosterone. If you allow your children to take vaccines or injections. They're drug takers. Just so you know, I'm just trying to keep it super simple. They are drug takers, yeah? And drugs will lower your testosterone. So if your children are taking drugs, you're literally setting them up for low testosterone in life. All right. And again, this is not me, this is science. I'm just keeping it super blunt. But one of the biggest killers of testosterone, let's see if anyone can guess very quickly. What's has one of the biggest impacts on our testosterone levels as men? What's one of the biggest things? Someone put it in the chat before I reveal it. Quick. One of the biggest things that can really have a knock-on effect on our, thank you, stress. Chronic stress. Yeah? Chronic stress. It's like the silent killer when it comes on to testosterone levels. Yeah? So by all means, black men, family, we need to do things to reduce our chronic stress levels. High stress equals high cortisol. Cortisol directly suppresses testosterone. So if you're stressed out, your testosterone levels are going to go through the floor. Yeah. You have to be doing things to try and lower your stress levels, whether it's you got to find something that works for you. Some men go gym, they let out their anger or let out their frustrations or whatever at the gym. By all means, meditation, some people do, breathing exercises, yeah, time outdoors, or just spending time with family. Yeah, like Shan said, the stress could be work stress, it could be financial stress, it could be housing stress, whatever it is. We need to, as a family, we need to work together to try and lower stress levels. And this is for men and women, but obviously tonight we're talking about men, yeah? Because men, unlike women, men don't talk when they're very, very stressed out, yeah? They kind of bottle it up, whereas women, you can't, if you're stressed out, you'll talk to your girls, you talk to your friends about it. Men, for whatever reason, ego or shame or whatever, especially if it's to do with finance or even the bedroom. Let's not go there. Or shall we go there? Shall we keep it 100 tonight? Yeah. If you're having bedroom issues due to stress, all of a sudden, you can't get hard or whatever, and it's affecting your relationship, who are you going to talk to? Men are not going to really divulge that information with another friend or whatever, but we should, you know what I mean? Because again, this is going to keep us healthy, making sure that our sexual health is on point. Staying sexually active is actually going to increase or maintain your testosterone levels. Healthy libido and sexual activity are linked to testosterone regulation. So if you're someone who's not having sex on a regular basis as a man, or you're struggling, yeah, certain things, probably stress in your life is affecting your bedroom activity, then yes, your testosterone levels are going to go down and down and down. Yeah. And again, these are things that I break down in my book, family. I truly believe we need to start learning our health from a black perspective. I break down things that we can do to increase our powers. I've got an acronym in my book. Power stands for plants, oxygen, water, exercise, rest, and sunlight. And I break that down scientifically, even using color images so young people can understand it as well. But this is very important information, family, especially when it comes on to black men, because for whatever reason, black men were not as open when it comes on to us struggling as women. And I think that nowadays, we definitely need to be. Yeah. And on that note, I'm going to open up the floor. So if you've got any questions or comments, by all means, raise your hand and you can go live. Or if you don't want to go live, put your question in the Q&A and I'll come to you. I'll come to your question in the Q&A. So let me go on to the people that have raised their hands. Let me start with Adrian. Adrian, you can unmute your mic, bro.
Hey, thanks for having me, Leon. Two things I just want to make mention of. One's personal, the other is observation of that poster advert where it says 1 in 4 black men will, have suffer from like prostate cancer.
Yeah.
Now, have you ever thought about the 5-finger rule, where 1 finger goes up in the dark side and 4 remaining out? To me, that's like a subliminal message.
1 in 4.
Yeah. And as far as I'm concerned, I believe this whole so-called made-up prostate cancer treatment is a form of like, it's part of that agenda of like depopulation of the world.
Okay. Yeah.
That's just my opinion. Now, I want to share something with you personal. I'm normally a private person, but this happened recently where at the start of the year, I suffered from 2 UTIs, urinary tract infections twice. I did successfully complete the antibiotics, but then the UTI returned a 3rd time. Now, I was doing so many things to try and resolve it. But anyway, last week, Wednesday, which will be like 2 weeks, this coming Wednesday, I had a scan at a clinic, for both the kidneys, bladder, urethra, and prostate. I was told that I'd have to wait until next week, Wednesday, to find out the results. Now, during that time, I got in touch with, I actually found a YouTube video to do with Kegel exercises, which actually helped to stop the frequent urination. That was one part of the problem down. Now, Wednesday gone, I phoned up the GP practice, who said that they can't give me the results because the GP who requested for the scan is actually off on leave. And I was so angry after they told me I'd have to wait till the following Monday, which is tomorrow. And I decided to do, for the 3rd time, your liver flush.
Oh, wow. Yeah.
Yeah, right. Now, after I completed the liver flush, when everything had like left me, that symptom, that number 1 symptom of the urinary tract infection was gone completely. The ammonia smell when I passed water, all of that was done.
Gone. Yeah.
So I've just continued doing the Kegel exercises, and I was, I've never looked back. I mean, I've actually gone to see Charles, who appeared on your show.
Yep.
A couple of Wednesdays ago. I've had a consultation with him yesterday,
Good.
So he's given me a list of things to purchase, etc. I didn't tell him that I was going to do I didn't tell him I was going to do your liver flush, but I had to do it for myself.
Yeah. Oh, well done, bro.
Yeah.
Well done, man.
Yeah, thank you.
I know the UTI, them urinary tract infections, they're not nice at all, man. But yeah.
Definitely not. So all credit to you, my friend.
Thank you, bro. Appreciate that. And I like the fact that you mentioned Charles. So a lot of people, when they listen to me, they'll be like, oh, well, because people think that I'm anti-doctor. I'm not anti-doctor. I'm just anti-falsehood. So if a doctor's telling you the truth, go on with the doctor. But if they're telling you lies, I'm like, nah, man, there's people in our community that can help you. So Adrian mentioned Charles. Those of you who are following me, I always mention Charles. Charles has got his herbal tech clinic and he's got his supplement company. So if I'm going to take a supplement, whether it's a vitamin D supplement or anything like that, I'm going to take it off of someone who I know, like Charles. Yeah. So there are people in our community doing some great work. You don't have to. I'm not saying don't, but you don't have to go doctors. You don't have to go hospital. There's people in our community that know what they're talking about. All right. Yomi, you can unmute your mic, bro.
Greetings, bro, Leon.
How's it going, bro? You right?
I'm good, bro. I'm good, bro. Thanks. How are you?
I'm very well. Can't
complain. Excellent. Great presentation. So I just want to say, ask 2 quick questions. First of all, it's unfortunate I missed your Hidden Science of Black Hair event. So I had a question related to that. In terms of what you said about DHT, Is there a way to balance DHT naturally to boost optimal hair growth without taking one of those DHT blockers that a lot of people are promoting these days? That you
Yeah, so
recommend?
my thing is, when it comes on to balancing hormones, it's holistic. So the things that I talk about in my book with regards to um, increasing your powers, so that's getting in more plants, oxygen, water, structured water from fruits and vegetables and that sort of stuff, juicing, exercise, strength training,
Mhm.
rest, getting enough rest because melatonin is actually what heals things in your body at night. So if
Yeah.
there is some form of damage in the hair follicles, if you're not getting sleep, then you're just not going to recover from those that sort of thing. Do you get what I'm
Mm.
saying? The thing
Mm.
is with the DHT, it seems like it's a quick fix because DHT does constrict those tiny, tiny blood vessels that feed the hair follicle. But when you take it, there's going to be a knock-on effect, and people don't
Yeah.
think about the knock-on effect. They just think, "Ah, DHT is making me lose my hair. Let me block DHT," and then it blocks it straight away because that's what the drug does. And then two twos in a couple years' time, there's some health effect from the blocking of the DHT. So
Mm.
my thing is just keep it holistic. We got to be doing these things on a regular basis, whether it's consuming the right foods for our melanin, getting enough sunlight for our melanin, structured water, juicing, exercising, getting enough rest. And the big one is stress. Because again,
Yes.
DHT, even if you're on a DHT blocker, is that blocking the stress? Because the stress is really the cause. Do you get what I'm
Exactly.
saying?
Yeah. Yeah.
A
Yeah.
lot of people who are losing their hair, a lot of black men who are losing their hair, it's due to stress. And the stress is usually family stress or financial stress. Yeah.
Yeah.
Family or financial or both. It's probably both because you got a family, you're trying to take care of them, you don't have money, boom, stress. Yeah. So
Mhm.
if you take a DHT blocker, that's not blocking the stress. So
Exactly.
it's not a solution in my eyes anyway.
Exactly. Yeah. And then lastly, quickly, you talked about the benefits of being, active sexually and stuff, and this for testosterone balance and that. But on the flip side of it, a lot of people promote semen retention. What's your thoughts on that and its benefits for testosterone and balance? What's your thoughts on
Yeah,
semen
someone
retention?
mentioned that in the chat as well. That's very interesting. Like, I don't know. It's something I'm definitely going to research. Semen retention is amazing. Like, semen retention can make you feel like a god if you can do it properly. Because
Mm.
properly is 3 months minimum. I think
Yeah.
from what I've been taught is like 4 months you got to do it for. Yeah. But semen retention is you retaining the ejaculation. So you're not losing all the nutrients that we usually use when we release, yeah, which is
Mm.
one of them is zinc. The main one is zinc, but we release a lot of nutrients as well. So when you don't, you're literally retaining your life force energy. And
Yeah.
science behind it is that life force energy, if you release it, it can create life. Literally, if you release it, the woman gets pregnant, you're literally creating life. But if you retain it, you can recreate your own life. You can literally use that life force energy to recreate your own life. However,
Yeah.
I don't know. I have to look at some studies. I don't know if it actually increases testosterone though.
Oh, okay.
I
Because I was
have to
wondering with
research.
that, where's the balance? Like, I mean, obviously, if you do it too much, then there's probably downsides to that too. If you're not releasing enough, like, trying to get the balance right, you know what I mean,
That's
between semen
true.
retention and activity.
That's true because I have seen research to suggest that if you're not sexually active, you're not doing it, that will decrease testosterone.
Oh, really?
Yeah, there's research to suggest that if you that's why they say being sexually active is something that regulates testosterone.
Mm.
It's a healthy thing as a man to be sexually active because it regulates testosterone. And there's scientific studies to suggest that it's healthy for your prostate as well. Have you
Okay.
heard about that? That ejaculation releasing
Yeah, they promote it
healthy.
on Google like that if you do it 21 times a month. But then some guy I follow on Instagram, he's saying that people have been doing that for ages, but then they still get all this prostate cancer talk these days. So, they're saying this, and then he related it to monks saying that sometimes they have lower levels of prostate cancer on it because they practice semen retention. So I guess it's about balance, I guess, really,
It's
ultimately.
balance. Yeah, it is balance. It is balance. But I definitely want to look into semen retention and testosterone because I know what benefits you can get from doing semen retention, but I don't know if it specifically increases DHT or
Testosterone.
testosterone or something like that. I don't know.
Okay. Thank you, my brother. Thank you for your time. Thank you.
Nice one, bro. All right, family. Let me see. Questions in the Q&A. Do white men The question in the Q&A is do white men also have darker genitals? I don't know, fam. I don't want to know. I don't know. I don't know. Do white men have darker genitals? I don't know. But just using common sense, I'm never gonna check, but using common sense, no, 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 they don't. They don't. Because they don't have melanin. What's gonna darken it? They don't have melanin. You get what I'm saying? So there's nothing to darken it. There's nothing to darken it. And then the next question is, if not, then why? That's the question. That's the answer. Melanin. That's why they don't have melanin down there. So what's going to darken it? The only thing that will happen is blood flow. So the blood flow is not going to darken it. It just can't happen. You get me? All right. This one says, is there any research on Black older Caribbean elders, African Caribbean elders comparing prostate cancer with younger generation? I there is research to suggest that in younger black men, I've forgotten what they say, but they say that there's the PSA test or something, either an enzyme or there's something that you can detect in younger black men with regards to their likelihood of getting prostate cancer when they're older. So there's something you can detect when they're younger. I'd have to go into that study and kind of get the information for you. All right, my father lived a good old age to 96, passed within a few days, and was never diagnosed with prostate cancer. He always cooked and ate a traditional Caribbean food. Yeah, more research needs to be done on this subject for prostate cancer. There is a solution. Yeah, and again, I always recommend that people do their own research and that sort of stuff. From my research, I've found that prostate cancer is one of the least aggressive cancers of them all. Yeah. Prostate cancer is one of the least aggressive cancers of them all. So when we're talking about, oh, black men, you need to go get tested, through my research, I've found that one, prostate cancer is one of the least. In other words, it's not as aggressive as, say, lung cancer or breast cancer or cervical cancer. It's not as aggressive, which means you could be diagnosed as a black man, you could be diagnosed with prostate cancer and pretty much live the rest of your life with prostate cancer. And then when you die, you end up dying of something else. You guys do your research. That's what I've found. Yeah. And that's not me saying don't get tested, do whatever you feel is best. If you want to go get tested, go get tested. But now you know the truth. You shouldn't be getting bent over to get tested. So don't make no doctor bend you over to get tested. Go get tested if you want to get tested. If you want to do the treatment, go and do the treatment if you want to do the treatment, but don't be under no false pretense. If you do the treatment, you will suffer from either incontinence, impotence, erectile dysfunction, or that other side effect, which is actually not a side effect. You could die from it. Yeah. So there you go. Now you know what to expect when you go for treatment. So by all means, do whatever you feel is best. All right, let's finish up, family. So for those of you who were there, big up the people who came to the Hidden Science of Black Hair, which was in Birmingham on Saturday. Absolutely amazing event. Over 700 people all together at this event. Yeah. People came from all over. People came from Manchester, Coventry, Belfast. No, not Belfast. Bristol. Yeah. London. Yeah. This was downstairs. We had performances downstairs and we had all the stalls downstairs. We also had workshops in one of the rooms downstairs. Like Legacy Center of Excellence, for those that don't know, is a black owned venue, but it's huge. It's absolutely huge, and they have these different parts where you can have workshops. So this was one of the workshops, went down really well. Big up the sis Sherilyn. She was telling people how to make their own hair care products using stuff in their kitchen. So this was a very powerful workshop. And then this was upstairs. We had the talks upstairs, and upstairs was Ram. So this is one of the speakers, Anytime Hair Coach. Look at her hair, very, very healthy hair she has. And upstairs was Ram Jam. There was damn near 400 people upstairs. Yeah. And again, people came from all over. So big up the people that came to this absolutely amazing event. And then we had, later on in the day, we had a Q&A. So we had all of our experts on the stage, Q&A with the audience, asking them questions, boom, boom, boom. So much knowledge, so much information shared. And this is yours truly breaking down what I said earlier with regards to black men and male pattern baldness and that sort of stuff. So yeah, large up everyone that came. Everyone loved the event. Oh my gosh, the feedback that we've been receiving is absolutely amazing. Yeah, to this day, it was like a week ago, and people are still raving about this event. So large up everyone for attending. We're gonna have some videos coming soon, so you guys are gonna see some content from this event. You're gonna see some visuals. Wait until you see the visuals. Big up everyone for making this such a huge success. On to the next one, family. Our next huge event is this one, the Hidden Science of Reggae Windrush Special, Saturday the 20th of June at the Radisson Red Hotel, Heathrow. You can come for the day event, which is going to be from 12 to 8. There's actually going to be an after party as well at the hotel, or you can come and join us and make it a weekender by booking onto our Reggae Weekender, which is from the Friday to the Sunday. If you book onto the Reggae Weekender, you'll have access to the 5-star hotel, so you access to the gym, sauna, steam, swimming pool, the restaurant, massage therapy facilities, all that sort of stuff, yeah? And this is what we're going to be breaking down at this monumental event. We're going to be breaking down how reggae has influenced all popular music genres in the UK. We're going to be talking about the untold story of Bob Marley in London, why Jamaican cultural appropriation is on the rise, and the deliberate erasure of Caribbean culture on TV. We're also going to be talking about the deliberate erasure of Caribbean culture, not just on TV, but just in general as well. I talked about this on my podcast, where there seems to be an erasure of Caribbean ownership. So the biggest reggae festival in the whole of Europe is called Reggae Land, and that's owned by two white boys from Ireland. Two white boys from Ireland own Reggae Land. And I said this in the previous podcast when I was talking about cultural ownership. Could I, as a black man from the UK with Jamaican heritage, could I put on something called Ireland? Yeah? A festival called Ireland, and book Irish bloody music artists from all over the world, and they perform at Ireland, and I make money from Ireland. I could not do that as a black man, but yet these two white dudes can put on an event called Reggae Land and book all of these reggae artists from all over the world and make Bam, we need to talk about this, yeah? We're also going to be talking about why they've always feared the Rastafarian movement, how roots reggae became the soundtrack for a spiritual revolution. We need another spiritual revolution, family. Oh my gosh, we need one right now. Why Melanin resonates with reggae and what sounds activate it. The secret power of low bass frequencies. Wait until you hear about that. And then Windrush, the true story that they don't want you to know. This is going to be a super powerful event, family. We got 700 people to our event, the Black Hair event. We're getting more for this one, family. If you have not got your tickets or your rooms booked, make sure you get your tickets booked. This is going to be a one-of-a-kind event, family. Get your tickets.
The Hidden Science of Reggae 2026. What impact has reggae music had on UK culture? Can melanin be activated by the low bass frequencies in roots reggae? Is the Windrush scandal a deliberate attempt to erase the powerful influence of Caribbean culture from British society? And what really happened to Bob Marley whilst he was in exile in London? All will be revealed at the most mind-blowing, historically informative, culturally relevant event of the last decade. The Hidden Science Academy, in collaboration with Hidden Truth and New Initiatives Catering, presents The Hidden Science of Reggae, Saturday the 20th of June 2026, from 12 to 8 p.m. at the Radisson Red Hotel, Heathrow. This event is an unbelievable exploration of reggae music, Caribbean culture. Come and experience an educational conference like no other. Speakers dropping the knowledge on the day include Robin Walker, the Black History Man, Andrew Muhammad, the investigator, Leon Marshall, the scientist, Lady Adele, the Hidden Truth Queen, Culture Mark from Black History Study, and some very special guests. This event is not to be missed. Get your early bird tickets today by visiting theinvestigator.org.uk/reggae, or extend this experience by booking a room at our Reggae Weekender, theinvestigator.org.uk/reggae weekender. Let's celebrate our culture like never before. Don't miss out. Get your tickets today.
Event of the year, family, event of the year. Get your tickets, get your tickets. We're posting the link in the chat right now, so make sure you get your tickets for that. We had the early bird tickets, the 2-for-1, so big up the people that got that. The tickets are still very affordable, and family, we haven't even mentioned the special guests yet. We are going to do that as of next week. So the next podcast, I will be mentioning the powerful special guest that we've got at this event. It's going to blow you away, family. Wait until next week or the next podcast when I announce our special guest. But yeah, big up everyone for staying right to the end. If this is your first time joining us, this is called Marshall's Melanin Podcast. We do this each and every Sunday, family, at 8 o'clock. And if you are on Instagram, by all means, you can follow me on Instagram at Leon Marshall Online. Large up everyone for staying right to the end. Enjoy the rest of your week, family. One love.
Genius.
It's funny how darkness is never considered a masculine trait in men, despite all the scientific evidence. Why is that? If you have high testosterone levels, how would you know? That's easy. Just look down below. My name is Leon Marshall, and that concludes the end of this podcast. Thank you everyone for being a part of this. You're a part of history, trust me. And just remember, be the light you seek. Just shine, man. More light, more love, more life. One.
Thanks for listening to Marshall's Melanin Podcast. If you like this episode, share it with your friends and family. To watch previous episodes, search Marshall's Melanin Podcast on YouTube. And if you're on Instagram, follow the scientist at Leon Marshall Online. Tune in next week for another explosive episode. And remember, keep shining.